Last month, the state of Colorado became the first to pass a bill capping insulin copays for insured patients. A similar Oklahoma bill proposed by Representative Forrest Bennett of Oklahoma City during the state's most recent legislative session failed to make it out of committee. Bennett plans to reintroduce similar legislation next year, with hopes for a similar Senate bill sponsored by State Senator Kerry Hicks. One problem for advocates working to reduce drug pricing is that the Colorado legislation does not offer any protections for the uninsured.
The people that don't have insurance, they're expected to pay the entirety of their health care, be it for the medication or for the follow-up with the physician, out of their pocket. And that eventually becomes cost prohibitive. People have to decide, well, am I going to eat dinner today or am I going to pay for my insulin?
According to the American Diabetes Association, of those diagnosed with the disease, at least 7.4 million diabetics require insulin to live. When the cost of insulin is too high, some patients resort to rationing or taking less medication in attempts to make the life-saving drug last longer. This choice can have costly and permanent effects.
The cost is typically spread out through other means such as taxpayer money and things like that. And you're talking about increased healthcare problems and increased mortality, people that are actually dying because they cannot afford their medication.
While middle-aged Americans are still the most commonly diagnosed with diabetes, researchers warn that college students are at an increased risk for developing the disease due to a number of factors, including poor dietary habits, physical inactivity, and high stress levels. In Edmond, Janae Williams, U Central News.